Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And today we're joined by Dr. Ara Bush. He's been with Surgeon's Choice here in the Detroit area for the last 5 years, and he specializes in hand and wrist injuries and treatment of those. So first of all, Dr. Bush, thanks for joining us this morning. How are you doing today?
Hey, I'm doing very well. Thanks for having me. Excited to talk to you and teach you a little bit more about hand surgery and what we do and what we have to offer.
Yeah, I mean, I love covering health topics because there's just so many different things to talk about, and there's so many new technologies always coming out. And I haven't really done much on the orthopedic end of things yet. And I figured rather than try to cover everything in orthopedics, let's start with the hand and wrist and try to simplify it a little bit for people. But so let's start a little bit with your background. You're a Michigan native, graduated from Wayne State back in 2010 in their medical school, and did some schooling out in Connecticut out east, and then ended up coming back here. So tell people a little bit about your background and why you're at Surgeon's Choice and why you're doing what you're doing now.
Yeah, absolutely. So getting into medical school, I always had a strong interest in surgery. I always knew that, I was going to do something in a surgical realm. And as I went through my training, I really was enthralled with the OR and special techniques. And as I kind of advanced through that training, hand surgery really stood out for me. The reason for that really is because, there's multiple tissues that we can work on in hand surgery: bone, tendon, nerve, soft tissue. But additionally, you get to deal with acute processes, you get to deal with chronic pathologies and disorders. And it's actually very rewarding to see how quickly you can change a person's life around. People can't go too long ignoring a hand problem since you use it so often in your daily life. And really, that kind of touches on another interest to me is, the hand itself. You think about it, you can use it to hold the jackhammer, build a skyscraper, but you can also use it to, compose a piece on the piano. And so really, it kind of has a wide variety of function. So I found an interest pretty early on in hand surgery, and I sought that out. I did go to the University of Connecticut to do additional training for hand surgery. And then being a Michigan native, my family's in the area, my wife's family's in the area. We knew we were going to come back. And so I ended up joining with the largest hand group in the area, Michigan Surgery Specialists, and we're closely affiliated with Surgeon's Choice. And so it was really just an easy match.
So let's talk about, you talk about all the uses of the hand. So let's kind of start with that. What types of people are most susceptible to hand injuries, hand issues based on their lifestyle?
Yeah, so that's a good question. So interestingly, there are a few peaks through a person's life where we see injuries to the hand or need for hand surgeons. Some of these occur, in the young athlete who's using them maybe has injuries during sports. We sometimes will see it very commonly in persons who are employed in occupations where they require use of their hands, manual laborers, things like that. And then we also see it in pregnant populations where, as people are carrying the baby, they have a higher risk for carpal tunnel or tendinopathies. And then additionally, as people age, they would develop arthritis. And so in the older population, we can see, need for treatments for those conditions.
So, obviously you want to help as many people as you can, but what are some tips you give to people to not have to use your services to that live those kind of lifestyles that they can maybe prevent some of these things or minimize some of these things?
Yeah. So the old adage, an ounce of prevention is worth a pound of cure. So just being kind to your hands, gentle with your joints. If you're doing activities that are, strenuous or, require a sustained amount of strain on the hands for a long period of time, taking breaks, being mindful, using support, and those sorts of things. And also trying not to ignore symptoms. Your body's trying to tell you things with these symptoms. And so listen to it. And if something seems to be bothersome and is, persisting longer than you would expect, then reach out and have it looked at. Because sometimes catching things early can save a lot of trouble down the road.
So, people can take their precautions and maybe that can help minimize things. But the bottom line is accidents happen, injuries happen, wear and tear happens. So you are going to need to help people out at some point. And the first goal, I'm sure, is always to try to avoid surgery, right? So let's start with the non-surgical treatments that you have to offer.
Exactly. So surgery is always a last resort. Sometimes it's, the only and best option, but there are other things that we offer to patients or to try to avoid it or circumvent it. Those things include therapeutic options. So, in each of our offices, we actually have occupational therapists who we work very closely with, who can see patients, work on things like range of motion exercises, nerve and tendon gliding exercises. There are specialized splints that we can provide patients to give them some relief. Sometimes there are medications that can provide relief, sometimes directed steroid injections to certain areas of the hand. All those things can be very beneficial to these patients.
So, and then of course, sometimes surgery is unavoidable. So what are some of the surgical techniques that you have, and maybe some of the little more cutting edge type stuff that you have?
Yeah, so we cover everything you can imagine that may affect the hand and wrist, from tendon nerve injuries, tendinitis, arthritis, wrist fractures, finger fractures, lacerations. There's been a big push now to kind of develop more minimally invasive techniques for addressing these, which we do employ through our practice. The main goal is getting people back using the hands, back to return to function quickly. And as I mentioned before, with the therapy that we have in each office, we're able to kind of get people in therapy to use it very quickly and kind of get the hand back up to speed very quickly after procedures or surgeries. And I think that's a big benefit and a big strength of our group.
And just from the research that I did before we did this podcast, it sounds like hand surgeries, of all the orthopedic surgeries that are done, are generally the most successful long term. Have you noticed a very high success rate? And then another question on that is, how long is the recovery time usually after these surgeries?
So to answer your first question, absolutely. The success rate is very high. We hold ourselves to extremely high standard. We're aiming for 100% all the time. Generally, as I mentioned, we want people to start using the hand right away. The sooner we can use it, the better. The hand is an interesting part of the body. It likes to be used. It responds to being engaged in activities. And so for simple things like carpal tunnel or trigger fingers, really we're getting those patients moving the very next day. Other things, like fractures, sometimes we're limited by needing to have some healing of the bone and ensuring things are stabilized. But really, as soon as is feasible, we're trying to get people into therapy and get them moving and, really shorten their recovery time.
One thing, probably the most common thing you hear the most about with hand injuries is, or hand ailments, is arthritis. And what are you seeing with that nowadays? And how quickly are people recovering from those procedures?
So arthritis is interesting because there's actually a certain pattern that we generally anticipate through just normal wear and tear, usually affecting the base of the thumb, which is a very common place to see it, and also the distal joints of the fingers. So surgery after the base of the thumb, arthritis, recovery time really is about 4 weeks, where we have to kind of immobilize people. And then right after that, about 4 weeks later, get them moving in therapy, back up to speed. But the good thing about the surgery for base of the thumb arthritis is that it's universally successful. The pain control is remarkable. A lot of patients will come in and say, you know what, I wish I would have done this earlier. And so we have really good success rates. And, for the most part, as soon as we are satisfied that there's enough healing and we're, able to move patients along, we get them, back to function.
And is that a forever fix with arthritis, or is that one of those constant battle like tooth decay where you're going to be always dealing with it, or is that something you can fix for the whole long term?
Yeah, so this is a permanent fix. We expect this to be a lifelong, never have to think about it again.
Very good, very good. Well, you had a good success story for me before we started recording here. So, in your 5 years at Surgeon's Choice, I'm sure you've seen a lot, but tell me about one that maybe stands out where you were really able to help somebody out.
Yeah, I'm glad you brought that up. So we had an unfortunate injury to a patient. It was a Saturday morning in February. I can still remember. where I got the phone call that a patient had a pretty significant injury to the hand, what we would consider to be a mangling injury, where the hand was actually caught in a paper shredder.
Oh,
So it was very involved, and with the help of multiple surgeons through Surgeon's Choice and different specialties, we were able to take the patient and repair the injuries, get good coverage for the wounds on the hand, refer them to therapy, get them back to motion and use, and the patient actually has returned to work and is back to near normal function. So I think that really kind of speaks to the strengths of Surgeon's Choice, where we have a lot of specialties, and it's not as if we're all individualized and compartmentalized. We actually work in tandem and as a group to kind of help. And I think that's one of the benefits, is that people are very happy to kind of be collegial and offer their support and services and just really do what's best for patients to get them back on the right track.
a hand through a paper shredder. That is unbelievable. I mean, I tried to think of some of the different things you might see as I was preparing for this, but a hand in a paper shredder is definitely not something that came to me.
No,
That's
it was,
unbelievable.
I think that one, is definitely takes the cake.
So that, I mean, to me, that almost sounds like sort of an urgent care emergency situation, especially on a Saturday. So are you able to help in situations like that?
Oh, absolutely. Yeah. So we, had the patient prepared and ready to go, urgently. OR, obviously, within, reasonable amount of time, within an hour or two. This patient in particular did need a few other surgeries, but, as you can tell, the outcome really spoke for itself.
So, you obviously have a passion for what you do, Dr. Bush, and I'm sure you would love to train others to do what you do down the road. And you were telling me about the fellowship opportunity now that Surgeon's Choice has, a hand fellowship. So talk a little bit more about that, and anybody that might be listening to this that can get involved.
Yeah. So education has always been an interest for our group and a strength. And because of that, our group, as I mentioned, is the largest hand surgery group in the state. For that reason, we had residents and sometimes fellows from plastic surgery that would come and train with us and shadow with us and learn about hand surgery. But we really thought it would be beneficial to start a fellowship dedicated to training hand surgeons. We have a high volume. We're all very invested in education. We like to teach. And so this past summer, we actually were approved by the ACGME, which is the accrediting body for medical education, to initiate a hand fellowship through our group, Michigan Surgery Specialists. We're the second hand fellowship in the state. So there's only two. And so we actually took our first fellow the first of this month. And so far, everything's going great, and we're all very happy. So, anyone that has any interest, there are surgeons out there who are still in training who have an interest in pursuing subspecialty hand training, then please, reach out, and we'd be happy to take you into consideration.
So do you have limited availability in the program, or anybody that wants to do it, you find a spot for them?
Good question. So we're approved for 2 spots a year.
Okay.
And so it's kind of interesting how things work. When we interview, we're actually interviewing for 2 years out. So right now we'd be considering applicants for 2023. But yeah, we're limited to about 2 spots a year, just to ensure that the participants coming through have appropriate training or will get the appropriate exposure.
Very good. And then we don't want to see this happen, but it's going to happen. People are going to need your services. So if somebody has hand injury, wrist, ailments, any of those, what's the best way to get an appointment with you?
So there are 2 ways. Nowadays, internet is quick and easy. It's at everyone's fingertips. So there are 2 websites. First website is surgeonschoice.com, which will pull you up to the Surgeon's Choice website. It has a list of physicians, not just hand surgery, but also, orthopedics, sports medicine, general surgery, etc. It also has a list of all the other modalities and options that the surgeon's choice has, such as imaging, laboratory. And then another website would be msspc.org. That's Michigan Surgery Specialists PC.org. And through there, they can also pull up, our particular hand surgery website and look through there and find a hand surgeon that, is either suitable for them or fits their geographic location.
Very good. Yes, I've been on your site, very user-friendly. So, if we were able to land you a fellow or land you a new patient today, somebody you can help out, this is well worth our time. At the very least, I'm going to be much more careful around the paper shredder going forward.
Yes, good idea. Always a good idea.
So, hey, Dr. Bush, thanks again for your time. Great information, and best of luck to you going forward.
Thanks, Ryan. Appreciate it. Nice talking to you.
You too.